Angela Stevens, and I am a senior level certified human resources professional. And I'm also a licensed marriage and family therapist here in the state of Kansas. And I wanted to share with you today something very personal to me, which is my journey with prediabetes. And I am going to use the help of Dr. Sarah Hallberg to help me with some of the statistics surrounding diabetes, of course. But again, I wanted to share my personal story with you. My hope is that some of you might be able to take away different tips and ideas. And my journey is certainly not going to work for all of you, pending your different medical conditions and things. And you should always have a conversation with your primary care provider or other specialist in the medical field, somebody that's a licensed medical practitioner, before you decide to either just take on this kind of a thing and rule out everything else or whatever. So I want to go back in time to 2013, October, to begin my story. I was a human resources director, and I was sitting at my desk working in a primarily white-collar technical place. But we had we manufactured a proprietary device. And so we had blue-collar workers, and I was used to dealing with a lot of the issues that they had. One of the issues that came about during that time was we had worked with a set of twins for about a year at the time I'd worked with them. And one of them came into my office one day and said to me that the other one had committed suicide the night before. He had shot himself in the head. And that was very difficult for me to hear. I am a Cancer. That's my zodiac sign, if you believe in any of that. But I'm a Cancer. I'm a very passionate and caring person. And I knew these people well. And it was like losing somebody that you cared for and loved. And so it took a lot for me to withhold my emotion. And I was very, very grateful and thankful that I had the ability to offer this individual or at least direct him to our employee assistance program, which provided a certain number of free sessions with a licensed counselor or therapist at the time. I felt good about that because I was not one at the time, and I felt very inadequate in my responses, but nonetheless was able to offer that kind of a resource. And shortly after he left my office, I ran to the bathroom, cried, got it all out, and resumed my day. Again, very difficult. Some people think that HR just are cutthroat, and that's just not true in many cases. So sitting at work one day, October 13th, 2013, I should say, I got a call from my sister, who is older by 7 years. She's 7 years older than me and very, very close to me. She's almost like my mom growing up. And she had not been well for some time, but she called me and said to me that her kidneys had failed. They were only at about 17%, and she was being rushed into surgery. The surgery was so that they could put a fistula in her arm, which is this big cut that they put into your arm to open it up to prepare you for hemodialysis. With kidneys failing, she would have to go to hemodialysis a few times a week to have her blood filtered through. It takes about 4 hours each time. And over the course of time, I got to see how draining that really was to her. But she suffered from some other things as well. And one of the things that she suffered from was diabetes. Type 2. And the diabetes, when she was diagnosed, was way back in 2009. And she said that the doctor had put her on metformin at the time. And she took that metformin for the longest time. And she believed that the metformin was responsible for the failure of her kidneys ultimately. So, I became very angry that she was on hemodialysis, because literaturely, I guess if that's even a word, in the literature, you can read that typically the lifespan associated with somebody who is on hemodialysis is about 2 to 5 years. So I knew that she didn't have long to live. I knew that in the course of that time, there would be some period of deterioration that I would have to witness. And that just wasn't something that I was prepared to deal with. So it's very, very difficult for me. And I created a bit of a rift with her to distance myself, maybe trying to protect myself, but that's kind of what I did at the time. A few years had gone by, and of course, our relationship, we became stronger than ever. And I would say that certainly in the later part of her life, we were very close. Her heart would start to stop, and she'd have to be revived. And the last time that had happened, she was put in ICU. And I remember saying, "I'm coming to visit you." And she said, "No, you're not coming. This is after COVID." So she's like, "I'm coming to visit." I'm like, "I'm coming to visit you." And she's like, "No, I'll be out of here in a couple of days. Just come visit me then." And I got busy, of course, just like we all do, never went to visit her. And the next call I got was one morning around 5:30, where she had literally fallen over and passed away, just like that. So that was my experience with her. She was a very stubborn woman. She did not adjust her diet. She did not adjust the way that she drank. She would go to Starbucks and drink caramel sugar lattes, galore. And caramel lattes have got to be probably some of the most sugary treats out there. And she would have this every morning, knowing that her body couldn't really function or filter it out. So not very smart, unfortunately, but that was her life. That's how she wanted to live it. But again, to go back, the diabetes, the kidney failure, after she took metformin, again, she truly believed that it was the metformin that had caused this. So she passed away in September of 2020, September 1st, to be exact. And it was just a couple of years before then that I had my own scare with some medical problems. I had endometriosis for quite some time, but at the time, my uterus had filled up with what they called adenomyosis. This is the endometriosis breaking into the uterus, and filled it up to the nines. So I had to go have an emergency hysterectomy and have that bitch evicted. And yes, I said that. I'm in a couple of groups for endometriosis. This is a disease that impacts 1 out of every 10 women, at least statistically speaking, from what I've read. And it is not very nice. It is very, very, very painful. It's a disease of the reproductive system. Many would say that that is what it is, but some others do believe that it's quite systemic. So I gained some weight from that hysterectomy, and that's quite normal. After about a year, they say your hormones go back to what they should, and your weight should go back to sort of a normal weight. And I didn't stop; I just kept gaining weight, and I'm about 5'0" nothing. So I ended up being about 160 pounds, which was for me very large. I didn't like it. I felt depressed. I felt ugly, getting older, all of these different things that any woman could possibly feel. And I just started to work out, and ferociously, 30 minutes a day. I was in calorie deficit mode. And so I was eating differently and thinking, I'm going to tackle this and I'm going to beat it. And I was not succeeding at all. I wasn't losing a single pound. So I said, something is crazy here. I went around the town getting all my blood work done from OBGYNs, endocrinology, etc. And I found out that everything looked good. So I was like, okay, well, is this really just all in my head? And, something, I'm just thinking all the wrong thoughts. So I'm frustrated. I'm feeling a bit defeated. And I get my calendar out and I'm like, I'm going to work out for 3 weeks. I'm going to put it on the calendar every single day that I did my 30 minutes. And I'm going to see what I'm weighing at the end of those 3 weeks. And surely there's going to be a change because there's nothing wrong. I've proven it. End of the 3 weeks comes. I haven't lost any weight. In fact, I've gained weight and still been in calorie deficit mode. So, there's just no explanation for what was happening. And it was very boggling. And I just thought I was stuck where I am. There's nothing I can do. And maybe a couple of weeks after, I came down with, I don't like to drink a lot of water, probably should drink a lot more, but I came down with a urinary tract infection, which is very painful. So it was the weekend. I went to the urgent care, to the ER, and the doctor there said, yep, you got the UTI, here's your antibiotics. By the way, you need to see your PCP because your blood sugar is too high. And I think it was like a 150 or something at the time. So I've certainly seen much, much higher blood sugars since then. But for me, that was quite high. So I went to the PCP, had my blood checked again. That wasn't something that they obviously checked before, and it was high. And I was diagnosed with prediabetes. So with that said, I'm just going to take a second to stop talking about me and share my screen. And, like I said, use some works from Dr. Sarah Hallberg here to help me out. Now, this statistical information is a little bit dated, but I think that it's pretty good information, and I didn't want to miss out on much of it at all, because these things are really important. So you see at the bottom, it says ketogenic diet for type 2 diabetes. We are talking about type 2 diabetes. I was not diagnosed with type 2 diabetes, but I was diagnosed with prediabetes. So that's sort of the prelude to type 2 diabetes, which is, as you heard from my sister's experience and her death, that it's a very nasty, horrible disease, especially if you don't take care of yourself during it. So this is the ketogenic diet for type 2 diabetes that Dr. Sarah Hallberg is talking about here. And she's also a master level individual. And the purpose of her PowerPoint here is to examine the current treatment limitations for patients with type 2 diabetes, research on carb restriction for diabetes, discuss the ketogenic diet, which again may not be for everybody, but this is the method that I used, and then ongoing study at Indiana University Health. So this work of hers is done in 2012, and she's outlining the statistics here. At that time, 14.3% of all adults had diabetes. So today, that's something like that translates to something like 80% of reported cases, according to the CDC, of adults that will have diabetes, and then 38%, a much higher number. So you can imagine what that might be today, that have prediabetes. And I want to stop there for a moment, because prediabetes would have been the last thing on my mind. I had no idea what it was. I had no idea what the signs or symptoms were. And this is ultimately what I learned. And I'll talk a little bit more about it later, but this is ultimately what I learned was my problem. So now in 2012, over 50%, which is 52.3%, have diabetes or pre-diabetes. And these are US statistics, of course. And this is a staggering number, and it's much higher today. In fact, I might do a separate class on that particular, something a little bit more recent. Of course, we could maybe even go back and look and see if we can't find some more recent statistics here. So this industry, you see all the dietary guidelines out there and gimmicks. Slim Fast has been around for ages. I use Slim Fast. It works a little bit, and then you gain the weight back because it's all about your control. There's so many diet pills out here you can take. I can tell you the ones I've taken that I really liked over the years were the apple cider vinegar vitamin pills, because they really aren't, hey, let's go get slim real fast, but they do have apparently some helpful traits to them, which are that they do help to normalize the blood sugar. And whenever I've taken them, they do help me maintain my weight. So I like that a lot. But, $245 billion a year industry just in 2012 alone. And this is not just inclusive of diet programs and the like. This is the total cost of to be diagnosed with diabetes in the United States. And folks that have diabetes have horrible medical bills. So you can just kind of use your imagination on that, but just a very, very costly industry. And I'll call it an industry because that's exactly what it is. I do believe that the diagnostic of diabetes is like it's like the DSM-5 in the world of psychology and diagnostics. You just can't put it all into one bubble. And I tend to think of diabetes as more of a metabolic systemic type of a disease because it impacts or has the ability to impact all of the organs in your body and make them work a lot harder than they normally would. So then we have this diagram or this pictogram that she's put together to show all the various costs. And this is from the American Diabetes with the American Diabetes Association, which, by the way, they have a wonderful, wonderful dietary program for those with diabetes. I don't know the exact name of it. I think it's called the plate method. And basically, things that have carbs in them you can have, but you got to understand the difference between what is complex and what are simple carbs. And we'll talk about that later. And then serving sizes are really critical as well. In my journey with diabetes, I lost quite a bit of weight, and I'll tell you, it had nothing to do with a calorie deficit, which everybody goes to calories. I'm eating too many calories. And that's possible. You could lose weight with a calorie deficit, but it isn't always about calories. I'll explain that a little later. But so there's this pictogram kind of explaining where all this money is going. And you can look her up and look at some of her work. But again, she's telling us that the solution here, and I'm going to flip through, she's coming into some more information here, which I really, again, I really don't want to get into too much of her work here. She's got a self-management education and support for adults with type 2 diabetes, which I personally never got into all this. It looks like she's maybe a nutritionist and she has some pathway for getting to where you ultimately should be. You can see that she's outlining a change in health conditions such as renal disease and stroke. The kidneys and the heart are really working very hard when your blood sugar, your blood pressure, and all these other things are out of whack. So this is why this is so important, and probably one of the reasons why my sister ended up having the issue that she had. Definitely emotional factors are a huge part of this, because not only are you dealing with a diagnostic, which can be quite traumatic, but thinking all the ways, how am I going to deal with this? What can I do to prevent living a life like that? If you've watched any of your family members deteriorate this way, it can be very scary. And then what are my basic living needs? Access to food, financial limitations. And that's actually a bigger issue than you would think, because to eat properly is very expensive. Eating organic foods and not just going to the corner, McDonald's, or going somewhere and picking up the cheapest foods, it's very expensive. So you have to think about some of that. And I'm just going to kind of flip through a little bit. But again, the point of this is for me to share my story with you. So I'm not going to go too much into the science of it all. Let me move that out of the way. I'm not going to go too much into the science of it all. So definitely agreeing with the promoting of healthy eating patterns, and that can be established or developed in several different ways. Again, my method was keto. She says achieve and maintain, that you can achieve and maintain body weight goals, attain individualized glycemic, blood pressure, and lipid goals, and delay or prevent the complications of diabetes. So every food that you eat has a glycemic index, and you really want the glycemic index to be low so that your body can process that food slowly. so that it doesn't kind of overload your system, and your body can kind of figure out what it needs, what to do with it. For all these years growing up, and you're a kid, or if you're athletic in any way, you might go on carb binges because that's energy. But if you're an adult who has a sedentary job and you're carb binging, eating, chips and candies and pies and cakes and things like this, that are not very good for you, then those carbs are sitting in your system, and ultimately your system starts to struggle with how to handle those, because they go into your system and they turn into sugar. And so your blood becomes overloaded. Again, your blood pressure, when you have high blood sugar, you have higher blood pressure. And when you have higher blood pressure, your heart is working harder to pump blood. Your kidneys are certainly working harder to filter out things. Your liver is struggling to filter things out that it should. And of course, when we talk about lipids, and of course, lipids would indicate that we're talking about probably some type of cholesterol, and where are those, the good, the bad, the ugly, and of course, triglycerides. All of those things are really important, and starting to really understand these things can make a big difference in your long-term health and how you're feeling, and delay or prevent the complications of diabetes. And in my case, when I told you I had pre-diabetes, I actually was able to fully reverse my diabetes completely. So I don't have pre-diabetes as I sit here today, which is great, because there's only one way to go. And that other one way is right into diabetes type 2. So addressing individual nutrition needs. There are, as I mentioned right at the beginning of this video, personal preferences, and not only personal preferences, but medical considerations that need to be taken in before you go and start a diet that may or may not work well for you, because you could have other medical conditions where you really shouldn't be doing keto. You really need to have, for example, potassium or something like that in your diet, and you're not going to get that. Cultural preferences could be an issue here. It's not something that I really thought about, because I was just me going through my journey. But if you have certain cultural preferences, some folks aren't going to take the metformin. They're not going to take a keto diet. They're going to continue to do what they do. They're going to heal in other ways, which I'm not an expert of, so I'm not going to talk about that too much. Health literacy. This is not something I had before my journey, but let me tell you something. I researched like the FBI to understand. The lady that my PCP at the time who diagnosed me literally said, right, your blood came back and you have pre-diabetes. Go take your metformin. I was very frustrated because she was a diabetic nutritionist, and she had no recommendations for me. There was just nothing. I felt completely out there with this diagnosis and lost. So that was very hurtful for me. You're going through the trauma of having a diagnosis and not really knowing what to do with it. So I researched a lot, and that's how I found the keto diet. And then, of course, access to resources. Some folks don't have access to resources. This is a big problem. So this type of a video and awareness, whether it's, professional or whether I'm looking like a dork on here, I really don't care. I mean, I think I'm getting enough across to you that it's going to be helpful to somebody, and I'm doing it for free. I'm not charging anybody anything. So I think that this is really good. And then the last thing she's listed out here is willingness, which I think is huge. I had a very special reason to take on the ketogenic diet. I did this, basically, I was stingy about sugar. Like I said, my sister had passed in September of 2020, and I was diagnosed in April of 2021 with the prediabetes finally. So by the time I got diagnosed, I was still grieving my sister and really angry about the fact that she was not alive. She was 50 years old when she passed. So she couldn't breathe anymore. She couldn't eat sugar and enjoy the foods that I got to enjoy. And who am I to enjoy the sugar when it killed my sister? It's how I felt. So you need to have a willingness. For me, I was very set in my ways with that, based on my experience. So that made it a little bit easier for me. It's not always easy to be willing to get rid of all the things that we like. When we talk about the differences between simple carbohydrates and complex carbohydrates and glycemic indexes and things like that, you have to understand that if you want to be serious about diabetes and making a reversal, you do have to make some significant adjustments in your diet. I am such a pasta freak. I love, love, love pasta. I haven't had pasta since my diagnosis in April of 2021. Pastas are a simple carbohydrate, and they are filled with carbohydrates that are very bad for you. Other things are bread and any other sort of pre-processed foods, sugary treats, anything, candy, soda, blah, blah, you name it. Those are simple carbohydrates. There are now, there's like a whole market of alternatives. If you're educated and aware, you can choose to use those alternatives. So for example, one regular size can of Coke has about 65 carbohydrates in it. A full-grown man or a woman probably shouldn't have more than 50 a day. And in this one can of Coke, you've gotten 65 carbohydrates into your body, and they're simple carbohydrates. So that's just going through your system very quickly, and your system has to know how to process that or not. Nowadays, you can get what's called Coke Zero or Diet Coke. And if you look at the carbs that are associated with those particular drinks, where the regular Coke had 65 carbs, the Coke Zero and the Diet Coke have 0 carbs. People say, well, but that's alternative sugar and there are risks associated. And they're right. There are risks associated with just about anything. But it certainly has helped me in my journey so that I can, when I did start to take in sugar, I could start to enjoy a little bit more of a normal life and not suffer. And again, I completely reversed my diabetes. So things like pasta, sodas, white breads, obviously all the candies, the chips, the stuff that's just junk food, anything under that junk food umbrella, even potatoes are just filled with carbohydrates, and it's going to cause you to have sugar problems. And I've seen people sugar way up in the 300, 600, 800 range, and they're having all kind of troubles, and they're taking their metformin and using the metformin really as a Band-Aid versus using the metformin wisely with adjusted food choices. My experience with metformin was short-lived. I was diagnosed. I took the metformin for about 3 weeks. And the very next day after I was diagnosed, I actually thought I was having a very healthy breakfast. I was eating a banana and half a cup of bran flakes with some 2% milk. And I had taken the metformin for the first time, and I started to have lightheadedness, blurred eyes, dizziness, all these things. I felt horrible. And I thought to myself, well, I just ate a very healthy meal. What's going on here? So at the time, I was aware of this thing. You can get it for free on your iPhone or on your Android phone. It's called Carb Manager. And so what you can do is you can put in the Carb Manager. It's free. You just put in what you ate, and it tells you how many carbs are associated with what you ate. And I had just intaken like 60 carbs in what I thought was a very healthy breakfast. My banana, my half a cup of bran flakes, in my milk, 2% milk. And it was not a healthy breakfast at all for me. And I felt awful. And I learned, at least that's what I feel, is that I learned that the metformin was there to create awareness for me as to what I could eat and what I couldn't eat based on how I felt. And then I used the Carb Manager. I went out and I researched groups of other folks that had this, and I found keto this way. I found a Facebook group, in all fairness, that was keto for beginners, and I just hung on to it. So for about 4 months, I was really hell-bent on not eating too much sugar because of what my sister had gone through. It was almost like I revolted against sugar. But for 4 months, and my son at the time, he must have been about 22, he said, "Mom, if you can't eat that, I'm not eating that." And he had a little bit of weight to lose at the time too, but there's nothing wrong with him physically. And in those 4 months that I did the ketogenic diet, this is supposed to be a temporary thing, not a forever thing. But the goal really was to learn how to eat healthy, and so that I could maintain a healthy weight, I could maintain a better health. standard. And I didn't realize that I was actually going to be able to reverse my diabetes, but we did. So I was 160, like I said. So I lost 32 pounds in those 4 months. Not a lot of exercise. This is just keto, clean keto. And my son lost 50 pounds in that same time frame. And so then what is clean keto? For me, clean keto was eating carbohydrates that were not a whole lot of them, but complex carbohydrates, like maybe having one serving of green beans along with my lean meat, like sirloin steak, instead of going to the grocery store and pulling off lunch meat off the counter. I would go to the deli and get fresh cut meat. So a little bit more expensive, as I mentioned earlier, to eat proper, so that you can start to impact your health in a better way. But again, a willingness isn't always the easiest thing to find. But if you're willing to concede that there are better ways for you to be eating, then you can start to really have a positive impact on all of these things that are happening in your body. Maintaining the pleasure of eating over the course of time, as I started to do the carb manager and see what the group was doing and do my own thing, my own variant thereof. Believe it or not, it only takes you a couple of weeks to know what you can eat. And if you're studying this, if you do it, it takes a couple of weeks to start to get used to it, and then you build habits. I think it was Stephen Covey that had the 7 habits of a leader, and something like if you did something 7 times over, or if you did something for like 28 days straight, you would develop the habit. It would become sort of second nature. I can't remember exactly what the words were, but I definitely experienced that. After a couple of weeks of putting every single meal in that carb manager, I knew exactly what I could eat, when I could eat it. And there were interesting combinations that I came up with, but certainly things that I really enjoyed to eat and love. And at some point down the road, I started to say, well, I can have a piece of that birthday cake, or I can have this, but with very much moderation. And I've been able to maintain that fairly well. You cannot, if you don't take anything else away from this video, the one thing that I would say to you is that in any diet, and this to me really isn't just a diet, it's a lifestyle. Because if I go back to the way that I was, apparently, even though I've never been the biggest, I thought that I was eating fairly healthy. Look, if you go back to the way that you were eating before, then you're going to go back to the same health status that you had before and make it worse. For me, this is not just a diet. This is a lifestyle, and I adjust accordingly. I don't live on keto, but if I gain a couple pounds because I ate Thanksgiving dinner, I had a cheat day, tomorrow I'm going right back on keto to get back where I should be, and I'm going to maintain that for a while. So it's a lifestyle choice, and it's really mind over matter, because they say you are what you eat. And if you eat a bunch of junk, well, your body's going to just turn into a bunch of junk. It's going to hurt you. So I maintain my pleasure of eating that way. I do eat fairly healthy still. Cheeses, cheeses are no carbs. Like I said, lean meats are no carbs. We talked about simple carbohydrates and that those are just junk. But you can take complex carbohydrates, and you want to pay attention to the servings, and you want to eat them one serving at a time. That's very important according to the American with Diabetes plate method. If you do that, you can have a serving of a complex carbohydrate, and you can find complex carbohydrates in things like fruits and vegetables, and those carbohydrates process through your body a little bit differently. They are naturally found in those types of foods. So while strawberries and different types of berries can have some carbohydrates in them, they are typically not terrible for a ketogenic diet. In fact, you can eat them. Strawberries have great health benefits for your heart. And so different health components to berries, but there are some more higher carb fruits that they will tell you to stay away from that are really not great nutritionally either anyway. They're not providing you much of anything. And there are some great pictograms out there that you can simply Google and look and see which fruits and which vegetables are higher or less in those carbohydrates. And then again, that glycemic index I was telling you about, the lower, I believe it is the lower the glycemic index. I'll look real quick. So the lower the glycemic index, it really impacts the way that you you affect your blood sugar level. So that's called blood glucose. So when they do your A1C, they're really looking at your glucose level and any carbohydrates that you eat, whether they be simple or complex carbohydrates that you put into your body. That is what's going to impact your glucose level in your blood. The glycemic index itself ranks food on a scale from 0 to 100, and the low end of the scale has foods that have little effect on your blood sugar level. And that's why it matters when I'm talking about the fruits and the vegetables, that you look and see which ones have a lower glycemic index. These are, again, fruits and vegetables, complex carbs. They're not the simple carb junk food. And so you want to pay attention to the glycemic index, because that's going to process slower through your body. So the slower it processes through your body, you're not going to have such an impact on your blood sugar, and you'll be just fine. So if you think of vegetables what could we look at? Asparagus. Asparagus is very good for your heart. I love asparagus, and I'll probably eat it anyway, even if I'm on keto, because I love asparagus if it's cooked right. But that's got a glycemic index of 15. A low GI or glycemic index is less, any vegetable that has less than 55. A medium glycemic index is anything between sort of 56 and 69. And then you just want to completely stay away from those that are high GI indexes, which are above 70 and over. But those that are falling in the medium are typically fruits like grapefruits, apples, peaches, oranges. Again, you can have these things. They process differently in your body, even though they come with all these natural sugars. Vegetables are typically the lowest on the totem pole in terms of the glycemic index. And you can certainly have those things. So Google that as well, glycemic index. That matters if you're struggling with blood sugar levels and you want to, over time, reduce your A1C. That's something that you're going to need to pay attention to. One interesting thing that I found, there are all kinds of glycemic index charts out online. Again, the Americans with Diabetes Association has some of the very best information, not surprisingly. Literally, they have the plate method diet. You can follow it. It's a great start if you don't want to do full keto. And there are so many other diets, but I would definitely recommend that if you're going to start somewhere, get yourself a really good Americans with Diabetes org book, or go online to the americanswithdiabetes.org, and you'll find some great stuff there as well. Back to the PowerPoint here. To provide an individual with diabetes the practical tools for developing healthy eating patterns rather than focusing on individual macronutrients. This is not something that I got into. I felt like I needed to be Einstein to understand this, but if you are very good at math, and maybe that's just the way my brain works, but micronutrients and macronutrients, then good for you. I seem to really just understand the glycemic index and the complex versus simple carb situation, and I try to avoid those simple carbs as much as humanly possible. The American with Diabetes Association have nutritional guidelines. This is some more up-to-date information. There is no single ideal dietary distribution of calories among carbohydrates. So that means, and that goes back to what I said, is that when I learned about this, I didn't go into a calorie deficit. I stopped looking at calories. I could care less, because it wasn't the calories that were going to help me get back to a normal weight and health. It was the carbohydrates that really were a toxin. And it's interesting because when I was in the military many years ago, I had much older gentleman that worked at the recreation center with me, and he was a petty officer. And he'd see me coming in with my chips and my candy bars and my pizza and all the things that I would eat. And he was like, "Girl, that stuff's gonna kill you one day." And he said, "You're just putting all these young people are just putting all these toxins in your body." And he was really right. I would have never thought twice about it. And now in my life, I really can think greatly about it and value what he had to say a lot. He's probably not around anymore, but we all really truly get told, we're raised to say, "Oh, you're having too many calories and you need to live on this 2,000 calorie per day diet." But it's so much more than just calories. And when I did my carbohydrate and low glycemic and keto diet type stuff, and all the plate method that I did as I moved out of keto eventually, it really had a lot less to do with the distribution of the calories and more to do with just knowing what I could eat, what was healthy and what wasn't. Be careful with the fats. And then, of course, there are proteins, which we'll talk about for people with diabetes as well. And this protein word is very, very critical, because when you start to understand how to calculate what you can eat, if it's a food that has carbohydrates in it, one of the things to understand is that the proteins are almost a 1-for-1 wash for carbohydrates. What does that mean? So if a food has 27 grams of carbohydrates and it has 29 grams of protein, it really doesn't have that impact on your body. So you can eat it. It's got a high protein intake, and it's like a wash for a wash. That's always worked for me, that method. There may be some opponents of that. I'm certainly a proponent. The ways that they tell you to calculate the net carbs in a food are there's a calculation. It's supposed to be the total carbs minus the dietary fibers minus the sugar alcohols, which give you the net carbs of that particular food. And you might want to write that down, but I always look at the protein as well. I'm minus the protein. And if the protein takes away all of it, then I can eat that food just fine. One thing I would caution you about is that when you have a high protein diet, you can get very constipated very quickly. Not something everybody likes to talk about, but you can get very constipated. So I would say if you're going to eat a high protein diet, to make sure you take something like what is it? Not Mucinex. Mucilax. I can't remember what it is. Oh my goodness, now I have to go and Google what it is. Miralax, that's what it is. So Miralax works with your water in your body to sort of naturally help you form soft and natural stools. So again, not the greatest topic to have to talk about, but just note that if you eat something that's high protein over the course of time, or you start with a high protein diet, you will make an impact on things, but it does have other factors to consider. She's going into micronutrients. She's saying here, just in short, carbohydrate intake has a direct effect on postprandial glucose levels in people with diabetes, meaning it is absolutely those carbohydrates, depending on what you do. If it's not low glycemic index, if it's a food that's not a complex carbohydrate, it is going to increase the carbohydrates in your blood. And you want to definitely monitor your carbohydrate intake. That's a very big deal. So, yeah, that's a good example. Take away this glass and then monitor the child. The child's not going to be there anymore. So that's probably not going to happen. Now they do something here for type 2 diabetes that I'm a little bit on the fence about. So people with type 2 diabetes, we do produce, well, and I don't have type 2 diabetes. I had pre-diabetes and I don't anymore, but they do produce insulin. It's just that their body doesn't know how to handle all the junk that's in their body. I mean, you think about it, high blood sugar, and then we're going to introduce insulin, which I just don't agree with that. If somebody's type 1, go ahead, take your insulin. But my type 2 body is already, if I had it, I'm already producing insulin. That's not necessarily the problem. I'm not saying that I'm a medical doctor in any way, shape, or form. I can't give out medical advice, but it seems kind of counterproductive to me to take somebody that has type 2 diabetes and let's just start administering insulin to them. There's so many ways that there's so many diets and things that we can try to adjust before we get to a point where we're even starting to take something like a metformin. Like I said, I only took the metformin for like 3 weeks just based on what my sister had said. She really adamantly believed that this was the cause of the deterioration of her kidneys. So I wasn't taking any chances with that. Yeah, so you can see how the carbohydrates impact your body's glycemic response as well. The more carbohydrates you have, the greater I would say the faster the glycemic response, which means that it doesn't have time to process through your body the way that it should, and it just all sits in there and turns into glucose. So then your blood is basically intoxicated with sugar. For people whose meal schedules or carbohydrate consumption is variable, regular counseling to help them. This is really important because I think there are so many people, they don't have the life skills. They don't have the motivators like I did. I mean, my sister died. What else kind of motivator is there? I've never been one to have addiction. So you deal with food addiction and multiple types of addiction in counseling. So that could be a factor. There's so many things to consider here that I can't cover on this video. But again, for people whose meal schedules or carbohydrate consumption is variable, regular counseling to help them understand the complex relationship between carbohydrate intake and insulin needs is important. Again, I'm not a proponent of insulin for type 2 diabetes, so I'm not going to cover too much of what she's talking about here. But in simple, if you eat carbs, your blood sugar rises, your insulin needs apparently go up. And there's a doctor out there that does a lot of YouTube videos who opposes the use of insulin in type 2 diabetes. And he believes in a different type of diet. I don't believe it's the ketogenic diet, but at one point I remember watching a number of his videos, and I'm sorry, I can't remember his name. And maybe I'll try to find it. But he really believed that this was a bad thing to be taking insulin with type 2. And he had several patients that reversed their diabetes or, had eaten themselves healthy again. And so I'll probably never be able to find his name while I'm on this video with you. But that was definitely something that made me take a step back and think, be careful what the doctors say, trust them, but also, your body. So if you can manage this without I feel like medications are so, you have to always do a cost benefit analysis. Is the risk greater than the need? If it's not, then you probably shouldn't take it. I had a patient ask me, if I take this medication, is it going to have unwanted side effects? Most likely you're going to get medications for various different things. And this was a counseling patient, but the different types of medications you're going to take for whatever reason are going to have unwanted side effects. And so he was concerned, that particular patient, and asked me that. And doctors aren't always necessarily going to be sensitive to that. They're there to give you a medical diagnosis and give you some medication. Here you go. How it impacts you. I've had people tell me that, they've had gallbladder ruptures by taking metformin. So or various different diabetes related medications that have had various different adverse effects on their body that they wouldn't have otherwise had they gone one of these routes and it really tried to manage their food instead of leaning on the medication as a band-aid. You just can't do that. It's something I highly do not recommend. Use the medication to help you form an awareness as to what you can take, but understand that the medication is not the end all be all. It's not going to fix everything. You do have to have an adjustment to your diet if you truly want to get more healthy. So she's talking about proteins here. Some research has found that successful management of type 2 diabetes with meal plans, including slightly higher levels of protein, 20 to 30%, which may contribute to increased, I always have a problem pronouncing this word, satiety. For me, as I mentioned to you, if I go replace a meal with a Slim Fast now has these Slim Fast shakes called advanced Slim Fast. So look for the advanced Slim Fast, and they've got like 20 plus proteins in them per bottle, versus if you go get the regular Slim Fast. And if you look at the nutritional facts on the back of the package, and just about every food has it. We're so used to just paying attention to the calories, but you can look at the saturated fats, you can look at the dietary fibers, you can look at the proteins, and you can see that the advanced one has more proteins in it, which again cancel out the effects of those carbohydrates. It's just a really good shake, and I took those for a while, so those are good. They taste good, and I would recommend anybody to try them. They're a little bit more expensive. Anything you eat that's going to make your health a lot better is going to cost a little bit more. Unfortunately, it's not so. I can't say that it's not so expensive anymore to go to McDonald's, because you could literally go to McDonald's and get a Big Mac meal for used to be $3.25, and now it's at like, I don't know, $15. So that's not exactly cheap either, but it's very expensive to eat healthy. My family and I go at least a couple of times a month over to Costco, and we'll buy some sirloin steaks in the bulk. And, think about it this way. Think about it in cost control method. If you eat healthier, it's a little bit more expensive, but what does it cost for you to go to the doctor when you have diabetes, right? So that's a way you got to think about it. Trust me, a lot more expensive to go to the doctor. So plus, who likes going to the doctor anyway? So I think I'm about done with this particular PowerPoint that she has. She does cover the Mediterranean diet. Like I said, there are so many diets. I love Mediterranean food. So definitely a good place for you to start. You can, again, the plate method by the Americans with Diabetes Association is a good place to start. I'm going to keep flipping through here. She's got about 100 pages. I probably won't be on here that long, but definitely some great stuff here. You're not going to get constipated on the Mediterranean diet. That's one good thing. The fruits and vegetables are very heart healthy, and you can consume lean meats on that diet. So it's a very good choice. If you like that kind of stuff, again, keep in mind that any bread you eat is going to have those are simple carbs that are going to impact your glucose levels. So, there's a clear advantage for low carb eating, whether you go keto, whether you go Mediterranean, or you find some other type of diet out here. But there's so many of them. You can mix them all up too. You can eat a little bit of keto, you can eat a little bit of Mediterranean. It doesn't matter. It's just overall healthy eating. It's an overall life change, and it works. I'm here to testify to you that it works, and it matters to me. And I've always wanted to do a video like this. I'm not a video person, as you can tell. I'm getting used to the idea of putting my face out there, and I don't care what I look like. Just let me get this information out to the people, because you really don't have to spend so much money. You really don't have to stress. I love doing nutritional coaching for people and helping them find a better way. I've done it with a number of different folks. I've worked with individuals that have anorexia nervosa. They have emotional health and a history of abuse attached to it, and various different reasons that they did it. I've collaborated with their medical doctors to get them on proper medication and build their trust to help them get into a better place. So I've done some of these things, and I just find it absolutely fascinating. Again, I'm not a certified nutritionist. I'm not a medical doctor. I can't give you any of that kind of advice. I'm sheerly doing this video based on my own experience. When you experience the death of a loved one, after you watch the deterioration of a loved one, and then to get diagnosed with something that had devastating effects on her, at least the prelude to type 2 diabetes is prediabetes, is what I was diagnosed with. And so it was a very scary time for me. I cried. My doctor literally was like, "Why are you crying for?" And I'm like, she just doesn't get it. And I feel bad for saying that, because just a couple of months later, unfortunately, this doctor, I'd had her for 7 years. She was very young, 55, diagnosed with cancer, and she tried to stay on the job. And even with cancer, I think you can adjust your diet to eat better and be healthier, but I wouldn't play with medications, don't know anything about medications in that regard. But she tried to get healthier and just kept deteriorating, so she had to retire at 55. So last I heard, she was doing well, but yeah, not very nice. So the goal is to get off the medications, people. Take the medication, but it's not an end all be all. It's not something that's going to fix the problem. And it's something that has whether or not my sister was right in all the strong ways that she felt that it had damaged her kidneys, whether the other people I'd spoken to were right, that it was actually the cause of the rupture of the organ, the gallbladder, or whatever, whatever. It's not supposed to be something that you take forever and just rely on it solely. Your nutrition really does matter. So she's talking about a couple of different diets. I think maybe instead of the plate method, they actually call it My Plate. In fact, they do. It's the American Association of Diabetes Educators and Healthy Eating Patterns. So it's called My Plate. I call it the plate method because it's based on serving size, paying attention to that. On the back of a can of green beans, if you look at all the nutritional facts, it tells you the sodium, the fats, the fibers, all this different stuff. But one really important piece of that is that whole can of beans is not a serving size. It's like 2 serving sizes. So if you eat the whole can and you eat 2 serving sizes, you've doubled everything you see there. Another thing to look at is you see percentages beside everything. You can't really see this, what I have, and this is just sugar-free gum, so it's not really going to affect anything, but you see percentages along the nutritional tab. And what you want to try to do, another trick of the trade, is you want to try to keep the percentage of each of those to about 5%. If it's over 5% of your daily intake, you're probably intaking too much. So we're not just looking at calories. In fact, I never looked at calories. What I did was look at my carbohydrates, and if there's nothing in there to cancel those carbohydrates, then I'm not taking it. If it's 27 grams of carbohydrates and there's no dietary fiber, no protein, no sugar, alcohols, I'm not having it. It's too much. If it's 27 grams of carbohydrates and it has 20 grams of protein and it has 3 grams of dietary fiber, then I can probably have that, because the net carbs that I'm intaking are very low. And then again, when you think about fruits and vegetables, and I'm not going into it too much here because you can Google it all day long and find a glycemic index chart, but you can see what fruits and vegetables have a high or a low glycemic index. And of course, remember that the lower ones are better for you because they process through your system very differently. It gives your body time to process rather than overload your blood. And that's really important. But so My Plate is one of the diets that you can do from the Diabetes Association, the American Association of Diabetes. The DASH diet, which I can honestly say is probably something I don't know anything about, but the Mediterranean diet, because I love Mediterranean food, is definitely something that I would recommend. And then, of course, they do say about a vegetarian or a vegan diet. And I think that that's something for some people and not for others. Personally, I like to eat meat. Speaking of meat, when people typically say I like to eat meat, they say, oh, I'm a meat and potatoes kind of guy, or I'm a meat and potatoes kind of girl. Potatoes are a complex carbohydrate. They are considered a vegetable, as you know, but they, in a heated state, are very starchy, and that starch can have a very damning impact on your glucose levels very quickly. So they are not, when they're hot, when you cook fries or when you cook, and you typically want to stay away from fried stuff anyway. But if you, for example, boil and make boiled potatoes or mashed potatoes and you eat them hot, that starch is still very high. So this is something else for you to Google and look at and learn about. That starch is very high, and it makes it has a higher glycemic index, and it causes a negative impact on the glucose in your system. So it will increase it. But interestingly enough, there is research, and I can attest to this, that if you let your potatoes, if you're like me and you love potatoes, if you let your potatoes cool to room temperature after you cook them, the glycemic index goes lower because the starch, they become starch resistant. So the terms for you to Google are potatoes and starch resistance, and learn all about that. And there are still people out there that say, oh no, it still impacts my sugar. And it might, different strokes for different folks. But for me, when I would eat cold potatoes at room temperature, that theory absolutely worked. It did not increase my blood sugar, and I was able to eat potatoes. So sometimes I would take a little bowl of cooled potatoes with some chicken and stuff in it, to work for food for lunch, and that was a good way of eating. So keep that in mind. Different kinds of diets, again, you can mix them all up. You don't have to just do keto. But if you want to get a good, strong start, keto, you can certainly do keto. Keto is really, like I said, just lean meats, eggs, just clean, no carbs. But, most of us need some carbs to function. You don't want to get into a situation where you become hypoglycemic. So when you have hyperglycemia, that means your blood sugar is too high. But when you have hypoglycemia, that can be deadly. That can make you feel disoriented. That can make you go into a diabetic coma. That can have a lot of detriments. So really, a good glycemic sugar index in terms of glycemia is, you want to be, if you Google it, it says that you want to be 70 and above. And believe it or not, there are people that when they start getting to 90 and 80, they start to feel the effects of their sugar dropping to lower levels. You can start to have blurred vision. You can start to feel disoriented and just mentally disoriented and groggy, and you can feel dizzy and all kind of things. Similarly, if your sugar is too high, you can have headache, you can have blurred vision, and you can feel very hot physically. So different things to look out for, but you definitely don't want your sugar to get too low. That's a very bad thing. So if you notice that your sugar is getting too high and then it's getting too low, you really want to start the process of checking your blood sugar to make sure that it's never getting too low. That's not a good thing. And talk to your doctor about that. So she has this Albert Einstein meme here, which is a great way to end the conversation. There's so much to talk about, but insanity is doing the same thing over and over again and expecting different results. And she's absolutely right. That's a perfect meme for this. If you are going to just take a medication every day and still do the same thing you've always done that got you diabetes and expect something different to happen, that's not going to happen. You are essentially taking this medication and leaning on it as if it's going to fix everything. And the truth is that medication has unwanted side effects that are going to cause you to have other problems the longer you take it. So it's really not something that you want to have for a long period of time, unless you have to, unless it's medically required because you've got something going on. I'm not saying that there isn't any reason why you shouldn't have to, because there are people that really do need to take their medication. So again, I don't give medical advice, but if you are just experiencing this and you want to make changes, you can absolutely change it. I'm a living proof and testament to that. And so With that said, again, insanity is doing the same thing over and over again, expecting different results. You have to consider all of the ways that your food is impacting you. And if you feel like you can't do that on your own, or you feel like you need some more education, then there are people like me. I'm a licensed marriage and family therapist. That doesn't mean I'm all knowing in everything. In order to become competent in many things, we go through them. I have a client that I'm coaching with regards to, I often do legal parenting coaching for family courts, but this particular client has a daughter with epilepsy. And I raised 2 children with epilepsy, so I'm very familiar with what that looks like. And so it isn't always just something that comes, she said to me, "Oh, I've been looking for a therapist that specializes in epilepsy." Well, there is no part of my educational career that taught me about epilepsy. So, it's hard sometimes, and the same goes for these nutritionists. They're not specialized necessarily in just diabetes or this or that. They're specialized in general nutrition to help you eat better, but they're not doctors either. And sometimes the doctors don't know it all either. Sometimes you take your 2-year-old to the doctor and you tell them something's wrong with my 2-year-old, and I know it and I can see it. And they tell you, "Oh, she's got a cold, go home and take this." And 2 years later, like that client finds out that my daughter does have something wrong and she has epilepsy. So what are we going to do about it now? So you know your body best. And this is the way that we have to start to tackle that problem, is you have to get the proper, you have to get some dialogue going with the right people. You have to take an interest in your own awareness and education. I think the awareness is sort of a superpower for all of us. It helps us regulate anything if we can be aware of what it is that's going on. So with that said, I appreciate your time today. I hope you learned some things from this video, and hopefully my story will help you or a loved one. And if you would like to get a hold of me, you can certainly reach out to me. My email is angela.stevens@amshcmfirm.com. Again, that's angela.stevens@amshcmfirm.com. I'm the owner of Bright Wisdom Therapy. Again, I'm a licensed marriage and family therapist, and I'm also the owner of AMS HCM Consulting for the human resources side of things. So with that said, I hope you have a great day, and we'll talk to you soon. Take care.